Hello. In this podcast with Dr. Sukumar Sura, Chairman and MD of Asian Spine Hospital, he's a senior endoscopic spine surgeon. During this conversation with him, we discussed about back pain among young population, elderly care, the way healthcare system has been evolving in India over decades, and also we discussed about challenges that are there in the healthcare system. So let's dive into the podcast and listen to it. Sir, we see a lot of young patients, especially in the age group of 30 and 40, having back pain, which is generally, I thought it was not a regular trend before, or is it something that is happening right now?
See, my take on this back pain or spine issues coming nowadays more often in youngsters. So it's a common topic we discuss wherever we go. And most of patients we are seeing also, young patients, especially teenagers, having more issues nowadays. So these all things, the common problem is same. Lack of physical activity, prolonged sitting, bad posture, so no breaks. So everything together, what does it does to the spine health is where the bad postures, especially a guy playing a video game or a guy looking at his tab or a mobile for long hours. What happens? Your neck is bent, your shoulders are rounded, your spine is hunched, and with that posture, over a period of time, muscles become weak, stiff, and a lot of impact on discs of the spine, and this leads to chronic spine issues. So this, starting with teenagers or adolescents, when you just move further to say 30s and 40s as you asked. So what happens, 30s and 40s, they studied very hard to reach to some position. They get a job. Yeah. Once you get a job, what is the job they are getting? Again a sitting
job. Yeah.
So they sat to prepare so hard to get to that position. Mm-hmm. So they were sitting, and again they are sitting now. So there is no physical activity at all. And what job they are choosing, most of the jobs are IT jobs or a bank jobs or any job nowadays is a desk job. So desk job, a 9 to 5 or 9 to 9 or 8 to 8 job. So you are sitting most of the time. Average you ask anyone, they say I am sitting almost 8 hours a day. So this sitting job again, you are inside 4 walls, no light whatsoever, with the same light throughout the day, no proper air. You breathe the same air, which is the quality is inside. So you are sitting inside 4 walls. You have a chair to sit, and you are hooked to the monitor. So the increased screen time, unknowingly. See, I ask or discuss with many of my IT friends. I ask them, okay, you are doing your work or work from home or work at place where they are working. So they say, when we are taking breaks, what do you do? They say we see YouTube or WhatsApp or we chat on phone or on the monitor again.
Yes.
So again you are hooked to a monitor in a different way.
Yes.
So 8 hours a day, you are almost on the either doing job on the monitor, sitting, or looking at gadgets, again sitting. So this is what happening to our 30-40 years generation, where they are more sitting, again no physical activity. This is leading to a lot of spine issues of late.
So these people who are having issues, is it leading to extreme pain in most of the cases, or it is mild pain wherein they can deal it with some kind of exercise and workout, and can they reverse it in any way?
The warning signs or warning signals, what we say, failure to understand these things. Adolescent sitting, watching or playing video games for hours together, he might have some neck catch or a back catch. He might tell his mom or father saying that he has a neck pain or a catch. So parents ignore that time, or they are not aware, or he doesn't tell them, or he himself ignores these warning things. So this might lead to, as this goes further, his pain, which is simple muscle catch, might lead to a serious disc issues leading to serious trouble. Yes, it can lead to serious issues where later date he can have a serious spine problems in coming years.
So generally when people have back problem, so what is the approach, sir? So is surgery the only route, or are there any alternate medications or something that we can try for it?
No, definitely for any pain coming from the spine, from the either neck or mid back or lower back, surgery is not the only answer. So most of the time, 90% of the time, it is muscle stiffness, joint stiffness, or some minor disc issues were the cause of this pain. So you just try to avoid what you are doing, try to stretch, simple exercises, discipline working, lifestyle modification. Even simple measures like this will resolve most of the issues. Beyond that, if still you have issues, you can consult a doctor, a concerned specialist, where they can clinically examine them, evaluate them, and only then decide what is the issue and how bad is the issue. Then does it need intervention? Only then a spine specialist come into picture. Till then, most of the time, 90% of the time, these issues can be solved with simple measures.
Sir, you are a specialist in endoscopic spine surgery. So, in my childhood, when I was seeing little older people getting spine surgery, so there was this misconception that people will be paralyzed after a spine surgery. So there were like a lot of misconceptions in this way. Then endoscopic spine surgery came, and I have seen more people getting this surgery. What is that difference that is endoscopic spine surgery offering, that is making the whole process simple and easy for the patient?
So I just take you a little bit backward. So when, say, 30 years back, when as a general surgeons we used to operate in the abdomen, for example, gallbladder removal or appendix removal or uterus removal, we used to give a big cuts, like, say, for example, a gallbladder surgery, if is required for a patient, we used to incise almost 10 or 15 centimeter here.
Okay.
And cut the muscles, strip open the muscles and open the abdomen, go there and remove the gallbladder with our hands. And it was more bloody, lot of blood loss was there, and lot of pain. So just imagine you are doing a 15 centimeter cut to the abdomen.
Yes.
Then came the laparoscopy, or what we common men say keyhole approach, where we pass tubes and with a camera see the pathology, and we can easily remove the pathology. So hardly 10-15 ml blood loss is there, and with a small punctures in the abdomen, 2 or 3, patient goes home next day, and you can do almost today any surgery in the abdomen, you can do it with keyhole approach. The same thing when it comes to do with the kidneys. So for most of the kidney procedures today, either be it a stone in the kidneys or in any other problem with the kidney, they do endoscopically or with this keyhole approach. Then the ENT procedures. Nowadays there is no ENT procedure. They do open. Everything is done endoscopically. So these advancements have come to the brain and spine surgeries also. So the latest advancement in spine surgery is endoscopic spine surgery. So we use the same principles as a laparoscopic surgery, where small long tubes will be there, so which has a camera, and this goes inside your spine and we operate through that small tube. So this is called endoscopic spine surgery. So with this, advantage is that you are only putting a small 6 to 8 mm small opening where this tube goes inside and does everything what a open surgeon want to do.
Okay.
So, and biggest advantage is the magnification. It is almost 20 to 30x magnification you are seeing the tissues. So obviously because it is under so much magnification, you injure less. So there is injury is less, blood loss is almost nil. There is no bone or muscle damage. So as a result of which, you just imagine in a elderly population, as you asked, elderly population where a big cut has to be given. Their muscles are weak. They already have so many other complications or diseases like diabetes, hypertension, heart surgery has already happened before. Some knee surgeries have happened before. So they are into so many multiple surgeries, multiple other health issues. They are fearful. So if the spine, again one more big surgery, they might not get up or walk. So and the complications which their relatives face, there is always these bad examples are always there in the family about spine surgeries where a family member got operated and became paralyzed. So these bad memories, so they'll make them fear. But good news for them is because of the endoscopy, that fear will not be there. They are up and mobile immediately. So last 2 days back, I operated a 80-year-old lady. So 80-year-old lady, mother of a dentist. So they went almost every doctor in the city saying that they have a spine issue, but every doctor told that she's old, having so many other morbidities. So the surgery, spine surgery is risky. So, but I did endoscopy on her, relieved her pressure on the nerves. She's so happy that the next day itself with a smiling face, she was greeting me and she walked home the next day. So that is a big advantage of endoscopy, where elderly population need not worry too much about complications, so that getting back on their feet is faster with less pain.
Sir, robotics is quite popular, gaining a lot of traction right now. So what is the role of robotic surgery in spine?
Common man, again there is a lot of confusion. People think that robot means everything is done by a robot. So there are various types of robotic surgeries. One type of robotic surgeries is where a surgeon sits away from the operating site. He will have a console adjacent to the operation theatre or just inside the theatre. He will have a console, and all the equipments are first set. The robotic arms are set on the patient. Then he sits on the console and he operates. It will be like a joystick movement where he will use all his fingers with operating the seeing. So the arm movement is done by the robot on the patient. There will be multiple arms, like say 6 to 8 arms will be there. So each arm carrying each instrument, one arm suction, one arm equipments holding the. So how a laparoscopic surgery, 3, 4 or 5 ports instruments are put in the abdomen to operate. So these instruments are held by a robotic arms. And a person managing these arms will be sitting somewhere in the console and will be operating. So this is one type of robotic surgery where nowadays remote, first time from Hyderabad, the surgeon operated sitting in Hyderabad. The northeast, a patient was operated in the theatre there in the northeast, sitting there. So all the people there helped him. So he operated from here. The main surgeon, he operated this from here because that surgery was very difficult, where the surgeons there were not able to do that or not trained in to do that surgery. So that is one type of robotic surgery. How does this help? The precision, because a surgeon doing say 8 hours or long hours of surgery, he gets fatigued. Arms get fatigued, and your assistant might not be same good as you, because you have only 2 arms. Only you can hold 2 instruments. So your assistant has to hold the different instruments. So for that uniform precision, this robot helps. So this is one technology. Second technology is where we call it as robotic-assisted,
Okay.
where surgeon has to be there on table. Surgeon is there doing assisting help would be the robot. Where, for example, in knee surgeries, they cut the knee precisely for the implant placement. So robotic arm will precisely cut the knee surface.
Okay.
So that again who feeds the data, surgeon feeds the data.
Okay.
So surgeon has to be there precisely doing surgery along with robot. So these are called robotic assisted.
Okay.
So same thing we do in spine also. So it's again in spine it is more used to put pedicle screws. Like when we are fixing the spine, we fix the spine with screws. So to place the screws precisely, so this robot is used. So again, you should understand, to run this robotic arm, surgeon is required, and data fed into the computer is the surgeon himself.
Okay.
If it is not fed correctly, then there will be devastating complications. Small error, like say 4 millimeter, there is error, then the screw, instead of going into the spine, it goes outside the spine. So these are the problems. So because robot does what you are telling that robot to do. So it is putting precisely screw into the spine, but what you have fed.
Yes.
So it means the intended location, what you feed, the screw goes there. So it should be precisely done with a good combination of a surgeon skills, understanding, and the robotic help. So we can do a precise surgery. So it is still people are learning, and in spine especially, there are few more years to come, the real usage of this robot, because whenever we say technology, high-end technology like robotic technology, it is a cost. Yes. So ultimately it drains to the patients. So when you are buying 6 to 10 crores of a robot today for a hospital, so the hospital is buying from its own pocket, right? So it has to again generate a revenue model where it can pay back.
Yes.
So again, who do they charge? They charge to the patient. So when you charge it to the patient, what happens? Say today's 50,000 or 1 lakh rupee surgery is costing 2 lakhs. So this 2 lakhs today to the patient, obviously it is you are increasing the cost to the patient. So is it really useful today? Definitely that is a very debatable topic. Years maybe in future we can tell the real usage where you benefit and also the economics match, then we can say it is beneficial to the patient. So definitely in coming years we can answer those questions, but definitely this technology is adding one more arm to the surgeon.
Sir, along with this new advancements in the technology for the surgery support and all, generally there is a perception that medical treatment, whatever happens, is not always supported by the alternate medicine or other practices that are generally available in the Indian systems. What are your take on that?
Yeah, definitely. See, being Indian by birth or by nature, we should always adopt a holistic approach. So, to take your grandmother or grandparents, whenever you are sick, when you are a child, they just give some recipe from the kitchen and you become all right. So hardly they take you to a doctor.
Yes.
Most of the time you are okay with some nuskas, grandparents, especially grandmother does, and you are all right. So it means that it is some native medicine their forefathers were using, and she never used allopathy medicine on you that time. So we should understand these philosophies. So we as a child grew taking some recipes from our kitchen. So that's why our kitchen is a great pharmacy that we fail to understand.
Yes.
So in same logic here, when it comes to spine health or any health, definitely we should not focus only on standard what to say foreign allopathic medicine which we are practicing today. It is not the answer for everything. So definitely there is now you might have heard about there is a lot of inflammation going inside you.
Yes.
People say.
Yes.
So what is that inflammation? Where it is coming from? Either it can be from your food or it can be from your lifestyle. So definitely it has not come from somewhere. Suddenly it has started. No. So our ancient understanding or our elders did understand that seasonal food, what should we eat, which season you should not eat, and time also. So you might have seen your grandmother telling, don't eat this food in the night.
Yeah.
Don't eat this fruit in the night.
Yes.
Sheetamautundi, or you get cold, you will catch cold, you
Yes,
don't eat.
yes,
So they knew that science of eating foods, and when you are sick, what foods you should avoid, what foods you should eat.
Yeah.
They had this unknown, no one told them the scientific basis of it, but they know that.
Yes, as
So
a
it is
practice.
being in our generations, this science is there, which is a lot of what to say knowledge behind it, or a lot of science behind it. We ignore that. So to have a good output, or this holistic approach is always important. So coming to our spine, especially for example, you need not always say that my medicine will treat you, no, cure you, no. So there are some, I always tell people, some people say going to Ayurveda, say I went to Kerala, I took a package of 30 days and I became alright.
Yes.
Yes, some people definitely do get better who have this joint stiffness or muscle stiffness. They go and these things definitely help. So same thing when it comes to the other techniques where they use simple stretches and simple exercises in different forms. So they have given different names, but ultimately motive is same. Either you stretch a muscle or strengthen a muscle.
Okay.
You do yoga, you do physiotherapy, you do strengthening exercise, going to gym. Motive is same. Either you strengthen the muscle or you increase the stretchability of the muscle.
Okay.
So these things are bottom line. So keep the muscle active and strengthen the muscle, increase the endurance, increase the elasticity of the muscle. So this is what a different philosophy names it differently, but ultimately bottom line is same.
Yeah.
So what I always tell is you holistically we can combine these things, take each few good things from each philosophy and amalgamate them, and definitely patient tailor-made approach we go, definitely that will help. This adapting all methods will definitely help patients in future, so that we should try to understand all the philosophies. Only then we can give the best results. We should not say that this is bad and it should be condemned. No. So we should take a good thing from each philosophy.
And as simple things like walking, sitting down on the floor have become, and also squatting and going, using toilets, these things have become like far-fetched things now. People are using Western toilets and sitting on the chair for long hours and sofas, and hardly people walk. Most of the time what they do is work out in a gym. So these things also are impacting spinal health, right?
Yes. So you might be going to your granny or grandparents' village during summer holidays. So that's what our habit of going to grandparents' house summer holidays during our childhood. So when I look back during my childhood, we didn't have any cars or bikes. So cycle was a luxury that time. So my grandparents, they never sit at one place. They constantly used to work They used to sit on the floor with cross-legged, do all the works, then walk to the farm or the field, cycle. So we used to cycle a lot to bring something. We used to go in a cycle or go to the field. We walk some say 8 kilometers, just very casual walk. You never feel that you have walked so long. Go there, come back. So when you look at the whole 24-hour schedule, only during your sleep or that 8 hours on the afternoon nap, half an hour or 45 minutes or 1 hour nap after lunch, whole day you are up and mobile or doing something to your muscles activity. So this was their regular exercise. What today people say you should go to gym and do exercise or move your legs. So deliberately nowadays people go to a gym or a Zumba or a cult or where they want to deliberately move your muscles.
Yeah.
So moving 1 hour of muscles in the gym is not enough. It has to be a whole day process. So why our grandparents never had issues? Because every day it was a process of moving the muscle.
Yeah.
Here our concept is move the muscle 1 hour and the next 12 hours in the day you sit.
Completely sit.
So that will not help. So that's why when you compare so what does the squatting does or folded leg sitting on the floor does? It stretches your knees, it stretches your hips, and it stretches your spine muscles and core muscles all the time. So you are doing this repeatedly. So you are sitting while eating half an hour thrice a day. Half an hour you are sitting on the floor. You want to chit chat, you are sitting on the floor. You again up and moving. You are squatting in the Indian toilet once or twice a day. That gives you a lot of, when you are squatting, the blood from the thigh muscles and from the hip muscles, it gushes up nicely. So that's why the squatting helps, where it improves your muscle circulation. So these things unknowingly, it was a part of our life during our olden days, where it was we just adapted it as a part of our life before. But with the advancements, so now we stopped walking because you have a bike or a car. You stopped sitting on the floor because you have sofas today. You stopped squatting because you have a western toilet today. So, and in the office, obviously you are not going to a field and bending and working there. You have an office chair to sit and work on computers. So everything we are doing opposite nowadays. So to circumvent that, we are telling we should go to a gym or we should do some exercise in the morning. That morning 1 hour is not enough. So that is a very wrong thing we do every day. Getting up and doing 1 hour of exercise in a day is enough. No, it's throughout the day we need to have a constant activity of the muscles. For that you have to be up and mobile, stretch yourself every half an hour, 45 minutes, get out of the chair, you walk, you stretch yourself, then again come back and sit. If possible, walk to the office, or one time you get down the stairs, climb up the stairs. Do something throughout the day, some activity every hour. You keep a task that you should move your muscles.
Yeah.
So
nowadays watches also have that thing, right? They track every.
So you are deliberately making a new device to remind you to do these things. So which is very unfortunate. Where our elders were doing unknowingly, it was a part of their life.
Yeah.
So again, we can't go back to the take back or go back in time, but definitely adapting those things in a new way will help us preventing lot of health issues.
Yeah. Staying in the topic of gym, sir, we see a lot of people having the slip discs. People say like they had a slip disc while they are doing deadlift. And so what exactly happens? Like I have heard people saying this, but I have never undergone. So I just wanted to know.
So we do get lot of patients come with a back pain. You just ask them when we're taking history, did you go to a gym? They say yes sir. So most of them youngsters who are coming with a slip disc or a severe back pain, they say I started gym recently, I did deadlifts recently, looking at the reels, I started this deadlift and got hurt. So there are two aspects here. One is the lack of warm up. Second thing is the lack of awareness who is the right person or when is the right time to do the deadlifts.
Okay.
There are the two aspects. One is the warm up. So these youngsters, you can say lack of awareness, or they are in a hurry, or they want everything faster.
And also people get a lot of emotional around doing workout. They have some kind of stress and they choose workout as a place where they vent it out.
So without warm up, so what do you mean by warm up is you might have seen cricketers or in any before game, they try to run, they try to do some exercises, they try to do some stretches. So what does this warm up do is when you do some stretches before you start actual lifting weights, this stretches helps to loosen the muscles, loosen the joints which are stiff, then try to increase the blood circulation to the muscles, wake up the nerves. When nerves were sedentary, not activated, so wake up the nerves, and as a result of which your whole body muscles, joints and the spine and the core muscles start becoming more flexible and pliable. Then you go and do your exercises, the lifts, then you will not face issues. Otherwise you will have a very bad muscle strain and you develop disc injuries. This is one part. The second part is the deadlifts. So every person is not same. Like say one procedure for all, it's not correct. So each person is different. So whether he is capable or his muscles are capable of lifting these weights, no one knows. So any thing a person wants to do a deadlifts, first need to strengthen his muscle, need to understand his body, whether it is capable of doing that. If you don't understand this, then deadlift would be very dangerous. So deadlift, though it is good, but it is very technical.
Yes.
Deadlift is very technical.
Yes.
So everyone can't just like this go and do it. If you don't practice or follow this proper technique, you will injure the back very bad.
Okay.
So to develop a good muscle strength and the core muscles, you first do warm-ups, exercises, then understand, then only go for deadlifts. So I think this professional lacking is causing this injuries to the spine. Lot of I see almost in a month 6 to 7 people coming to me in OP where they are having spine issues because of the gym or the deadlifts.
Sir, since you are also heading a hospital, so what kind of challenges that you are seeing right now in the healthcare system in India, sir?
See, definitely the hospital, the moment we say running a hospital, from an entrepreneur point of view or a owner point of view, there are definitely challenges. So from real estate where you should have a building, either it's a own building or a leased building, to taxes or electricity bills, other things. So it's a definitely you might not be knowing for a hospital the taxes whatever we pay or electricity bills whatever we pay are a rate of a 5-star hotel.
Okay.
It comes under the same
slab
category or a slab.
Okay.
So obviously the costs are very high when you say it is a hospital where you are a private hospital you are building or running. Then comes the human, dependency.
Yeah.
So there's a lot of teams required to manage a hospital, starting from the housekeeping workers to the security staff, to the theatre staff, to the front desk staff, to the wards, sisters staff, and technical support staff, and background IT staff. So many people are there to. So this managing this human area where human resources is very challenging.
And in that particularly having a single specialty hospital, your hospital, Asian Spine Hospital. So, how tough was it to run a single specialty hospital as compared to a
Yes,
multi-specialty?
definitely. As I said, along with these challenges, now you are bringing something new
Yes.
into the industry or into the health care, where you are trying to tell people or tell everyone that hey, there is a technique or a technology where this will help the younger population, elder population at the same time. So when I'm telling a new thing or bringing a new technology or a technique into the healthcare, there is a lot of resistance. So there need to be a lot of awareness. People have to adapt it. We need to show the consistent results, and these results will then there is a snowballing effect where for the moment patient sees the benefit or people start understanding, or young surgeons or the fellow surgeons start understanding this technology, and they too start adapting it, and instead of 1%, 10 people are talking about it, then only this goes forward. So to happen that when I say single specialty talking about a new technology, then definitely it is a real challenge. So you need to have a very lion heart to run this, take this forward.
Yeah.
Because everything is not that easy. There is a lot of resistance where
But there is a very positive trend if you see, like AIG, which started as a single specialty, now it is such a huge hospital.
Yes,
And also in the same way, in every specialty there is some
you
thing
should
that
see
is...
the commitment and conviction behind this success. So we only talk about the success. How many human hours went behind this, dedicating to bring this technology and technique forward. So definitely it takes years, and few people are very fortunate to sustain these pressures. But we are very happy. At least today we are. It's been since 4 years since we started this, and definitely people are happy today. Almost we have operated more than 2,500 patients here, and they are happy patients now. Definitely they are our brand ambassadors or flag bearers, where this is going forward, and awareness is picking up in spine endoscopy. Now everyone wants to learn and get a spine endoscopy as a procedure.
Though operationally it might be challenging running a single specialty hospital, there is also this advantage, like people are more trusting, or they have this specific likability towards when something is super specialized or specialized in a particular
definitely,
field.
yes. So you can say, for example, a patient comes to a clinic. You see him and say, you come to XYZ hospital, I work there. They say, no sir, if I come there, it's a very big hospital, I get lost. There's a lot of wastage of time. I have to spend more time just for my small problem. I have to spend more time getting investigated there and wait for a long hours for my surgery. When it is a single specialty, it is you can say bridge between, or it is in between a multi-specialty hospital and a small clinic.
Yes.
It's in between, where you can still have a patient talking to you directly one-on-one, and again you need not wait in queues or get things done same day and discharge the next day. So he doesn't feel that burden of waiting and seeing that rush and getting lost in the crowd. So that's how the advantage of a single specialty, where one-to-one attachment is there, focus is there, and you are working the same thing every day. So as a result of which, your results are also much better. So in that way, single specialty always has more advantage. Patient perspective, when you take a patient perspective, definitely for him it is more comfortable. So it's like a boutique hospitals, or where
And discoverability for patient also is much easier if it is a single specialty. Sir, we hear a lot of positive news when it comes to health sector in India. When we talk about Vikasit Bharat or India 2047, generally there is a lot of aspiration, but what happens on the ground is very less. But when it comes to healthcare sector, positively because of pharma, which started in 1990s, and post that also in healthcare, people Indians who live abroad also come to India to get surgery done. Maybe it is because of the affordability, but people are never going to compromise on health for affordability. It's definitely there is a high quality of care that is being offered in India. So what is your take on that?
Yeah, definitely last 20 years there is a lot of development in the healthcare industry in India, be it health medical tourism or healthcare per se, the technology development, definitely a lot of advancements in India, and also the scale of hospitals, where when you say Hyderabad 20 years back and today, definitely we are one of the leading healthcare providers in India today. So you can say we are in the top 3 segment where Hyderabad is moving in such a rapid pace. So how does this happen? Definitely when you say when you compare USA, Canada, I get so many patients from they say, when we talk to them, they say day before yesterday I got a call from one of my known relative who lives in Europe, Netherlands. She called me that she has a headache, and she went to a doctor with the difficulty. She got an appointment. She talked to him, and he wrote investigations. That investigations she got a time after 3 months.
Okay.
So her MRI is scheduled after 3 months. Then she got MRI. 3 months she suffered pain. She got MRI report, and she has to show that MRI back to the doctor. And the doctor said your appointment is fixed after 3 months.
In India, we can't even imagine.
MRI, yes. So to the doctor again, it is again after 3 months. So for a headache, you get a MRI done and show it to a doctor, it is taking 6 months. So such is the system there. It is not a fault, it is because of the number of doctors there, and number of hours they work there. It matters for them. So as a result of it, there is lot of waiting, and a patient really who deserves it. I still remember a patient traveled all the way from Canada in lot of pain and got operated here in our hospital just because he couldn't get time for surgery. They said his waiting list is more than a month. So then he has to come here only for surgery. So what does this say? This has increased the doctors mindset there, and the working hours there has made Indian doctors more preferred. Second is the quality of surgeries, quality of medical system in India, the science what we follow and what we do treat, it is, you can say, on par or better than them. So definitely the knowledge is on par with them. So today definitely they seek our treatment because of our knowledge. Third thing is the technology. So before in India, if you want to have advanced technology, people say go to Bombay because you have a technology there. But with the good advancements of the corporate care, definitely this technology push. Now in India, you say it is there in Germany, it is there in US. We have also there at the same time in India now. So as a result of it, there is no technology change whether you go to Germany, you go to USA, or you get it done here. There is no technology difference. And Hyderabad per se, because of the thanks to all our colleagues, fellow doctors, they have started their own hospitals and adapting this technology. Today we are almost leading in so many fields. We can boast of the top-notch healthcare leaders, we can say, in India today. Hyderabad stands on top of the list.
In medical care, there is contrast difference between hospital care and other ways of treatment. So why is there such a huge delay in adapting integrated approach, sir? What do you feel?
So as we discussed before, it is a mindset where we think Western treatment is a standard of care. We fail to understand our roots, that our ancient systems were very solid, robust, and it were time tested, and our methods were very scientific. So always try to adapt those things, inculcate those methods, so it will definitely help, especially spine care. I always say that that's why in our hospital we have everything at one place, where we have yoga, we have physiotherapy, we have naturopathy, with other methods, Western methods. So we are trying to incorporate every method and tailor-made to the patient, where we can give it best results, the outcome to the patient. Each patient is different. So some patients, stretching of the muscle is important. Some patient, strengthening of the muscle is important. Some patient, to reduce the inflammation is important. So we can adapt different approaches holistically to give the best result. So definitely in spine care, this is what we are following, and scope is in future there's a lot of scope, where a single center or under one roof you have everything. It's not that you are promoting only one thing and you are very good at it, and other things are not that good. So you need to refer to that center outside your hospital limits where to get the treatment. So patient gets again, you can't afford leave or stay away from work for very long time. So to have a good outcome, if you have everything under one roof, so definitely this becomes a good, giving a good output to the patient is possible. So that's what we thought, and our vision was to create this, and we are partially successful in that way. So hope in future we integrate further and other philosophies also. But I think I see a great future in this, as you asked, adopting other methods. There is a great future, and even in now the government of India is pushing to adopt the other methods also. So definitely there is a lot of scope in future. I remember one patient was young patient, around 28-29 years. He's an IT professional, a little bit on the fatter side. He was obese. So he got engaged, and his marriage was there in 2 months or so. So someone said there is a pre-wedding shoot, you need to look lean. So he said, okay, I should lose weight. So usually friends discuss. So someone said, because to that time when you were pre-wedding shoot, to wear some t-shirts and so you should have some muscle, you should look lean. He saw some reels and started talking to his friends, and someone suggested you should join the gym. He went to gym, and out of curiosity he said, I want to, so everyone were doing deadlifts. He wanted to do deadlifts because he thought I can lose weight and make some muscles faster. He started doing deadlift, and third day suddenly he heard a click. Said he just fell down there, was not able to move because of the pain. So someone gave him spray which was available in the gym, and they took him to the nearby doctor. He gave some painkiller injection. So he was okay. Then he went home, slept that night with some pain, but next day he started having difficulty in walking. He was not able to walk properly. Then same evening he started having bladder issues. Not able to pass urine.
So generally people with spine problems have lower body issues, sir?
Yes, so because most of the time lumbar disc ruptures. So when lumbar disc ruptures, you will have a pain like sciatica, which comes down the leg. or they will have other issues like numbness, tingling sensation in both legs or one leg, or then bladder issues if it is severe, where bladder nerves are getting compressed, or they get constipated. So these are the common issues, or they will develop even foot weakness or knee weakness if things are more severe. So this gentleman came to our emergency saying that 2 days back he had this issue and now he is a walking difficulty with bladder. And when I examined him, his foot was a little bit weak and his sensation was less, and we did ultrasound and he was not able to void properly, and his bladder was retaining the urine even after going to wash. Got a MRI, it was a huge disc which had ruptured at L4 and L5. Now you imagine his plight. He wanted a pre-wedding shoot to look better. Someone told that gym is better. He had never gone to a gym. He was never an exercise guy. He was a sedentary, happy to go type person, where he used to go to office, come back, sleep, 8 hours, 9 hours a job. So that guy hit the gym out of the blue, did a deadlift, that's it. So then we have to operate him, but you just go through his agony. He has a marriage in 2 months, he has a pre-wedding shoot, and now he has to get better. Now he is not able to walk. So whole family was shattered, whether to tell the relatives or not, announce this or not. What if after surgery, everyone, they met 2 doctors, they said surgery immediately. So then whether to go for surgery, what if after surgery, then the relatives think that whether he will be capable for the family to run, can he do, his personal things will be okay. So many things goes in the minds of the family, and suddenly they were devastated. So they came to us and I said, see, marriage is apart, first is your health. So you have to be on your toes, and we have to protect your bladder function as early as possible. We'll do the procedure, but he was more worried, can I go to the shoot and can I make it up to the marriage time. So I said yes, definitely, because we do endoscopy, you can get and walk. And so then he still waited for one more day, but he couldn't bear the pain. So then 3rd day we operated, and he was up and walking next day. Luckily his bladder improved within a week, and he was passing urine normally within a week. And God grace, he was back to his routine and did a successful video shoot, and he married. There's a lot of these youngsters going to gym, doing deadlifts, or a gym, or females especially, they go to this Zumba and Cult Fit, where things are more rigorous, and they want to do a crash course kind of a thing, and suddenly they develop this disc issues. And I seen there are 2 instances commonly I've seen. One thing is there is a marriage where you are to get married, or you have a sister is getting married, or someone close getting married, you want to look fit, they do crash course. Or they want to, like, say you are now in 40s, you have relaxed, you have settled down, kids are now into schools, there is no need to worry about them. Now you want to look smart and fit. So the females, especially 40 plus, they try to suddenly start doing some gym. They can go to gym or this aggressive things, workouts, and they develop disc issues and spine issues.
So it has to be more gradual.
I've seen this very commonly nowadays. This trend towards more of going to gym or this crash course things, they are developing spine issues. So I need to make aware that they need to be more gradual and more consistent rather. They are not consistent. Consistency is the key. The spine health, muscle health, or when you say fitness, fitness, constant and consistency is the key. Otherwise, they will have a lot of issues.